2025 Travelers Championship is hitting the fairway this week. Hartford Healthcare Sports Zone, located at the 15th tee and 16th green, will be in full swing, offering fans exciting giveaways and a place to watch the action. Joining us live this morning to talk more about back pain when playing the game that so many people love is Dr. Makanji, an orthopedic spine surgeon and director of clinical research at Hartford Hospital's Bone and Joint Institute. Nice to see you, doctor. Good morning.
Good morning. Thanks for having me.
Of course. So a lot of eyes, obviously, on the world of golf after this weekend, especially the U.S. Open, and as we head into the Travelers Championship. As a physician, as a surgeon, what are some of the injuries you see most with golfers?
Yeah, the most common injuries we see with golfers are usually muscular in nature, usually strains and pulls. While, they don't sound serious, they can certainly cause a lot of pain, sometimes difficulty standing and walking. Some heal very quickly, some may take a little bit longer. Some of the other problems in relation to the discs and the nerves are less common in golf injuries. So the muscular things are usually the most common thing we see.
And what typically, I guess, causes low back pain?
So low back pain in general is usually going to be muscular in nature or structural in nature. So muscular refers to strains, throwing out your back,
Yep.
muscle imbalance between the core and the glutes and the legs and your back. Structural things, refer to things like disc degeneration and disc bulging, nerve compression, things like spinal stenosis, which is a situation when the spinal canal does not have enough room and you have pinching of the nerves. So those are our two sort of main broad categories that we deal with.
What are some of the ways we can relieve this pain, or I guess prevent it? You often see golfers stretching, warming up. I'm sure that's helpful when it comes to not only the game, but also protecting your body, your back specifically.
Yeah, so I mean, from a prevention standpoint, stretching is probably the single most important thing you can do. And it's not just about your back. It's a complex relationship between your legs, your
Right.
back, your core. And so it's important to stretch everything. Even 5 minutes of stretching can really be very helpful. In situations when people do need treatment, physical therapy is typically our first line treatment for almost all low back issues. And in the cases when physical therapy is not enough, non-invasive treatments are available, such as spinal injections that can help target where the pain is coming from and also expedite the healing process.
And when do you?
Sorry, go ahead.
Nope, go ahead.
Well, I was saying, in the infrequent case, when you do need to think about something like surgery, the advancements and the technology that we have at the Bone and Joint Institute allow us to really offer a lot of minimally invasive solutions to get people back on their feet pretty quickly.
Wonderful. And that leads me to this question. When do you really recommend that someone take that step to see someone like yourself? We can wake up and we could say, oh, I slept wrong, my back is hurting me, or I played 18 holes, my back is hurting me. But when do you really know when it's time to take that next step and perhaps see an orthopedic?
So typically, if you've tried sort of the normal things that you would try when something hurts, stretching, anti-inflammatories, icing, things like that, uh, though that's probably a time where you might want, and you haven't gotten better, that's probably a time where you want to seek out, more treatment. And again, it doesn't have to be an orthopedist. Physical therapy is going to be our first line treatment. If you've tried physical therapy and then you sort of need to take the next step, at that point, a specialist can be very important to help guide you in the right direction.
Good information, Dr. Makanji. Thank you so much for your time.
Absolutely. Thanks for having me.
You're welcome. Thank you.